about neuropsych evaluations, but you're wondering what they are, why would I get one? And they're a lot of time and investment. So when should I choose to go with a neuropsych evaluation? Or you're also potentially wondering, how can I help my kid with homework? So the great news is we're going to cover both of those ideas today with Dr. Joshua Shifrin, who is joining us, and such a pleasure to have you here.
Thanks for having me, Veronica. I appreciate it.
I'm delighted. And Dr. Joshua Shifrin, I love his experience because he has been a school psychologist and then got a PhD in psychology and a certification in school neuropsychology and another certification for clinical ADHD clinical services provider.
Yeah.
So it's a great combination to address exactly this topic, because what better experience could you possibly have to be able to talk?
I appreciate it. Thank you.
So to jump right in there, can you tell us, how did you had a period of time where you were doing school psychology and then you went into this focus with neuropsychology. Was there a reason behind that, or what happened there?
Yeah. It's funny because when I started my school psychology program in the late '90s, early 2000s, I had planned that to be the terminal degree. I had planned that for my school psych degree, I was going to start with a master's in what's called a specialist degree, and that would be my endpoint. And I finished my school psych degree. It's kind of like two masters, a master's and a specialist degree. It took me 3 years. And I began working as a school psychologist, and I actually loved the work. It was terrific. And after several years, I said, you know what? I can't believe I'm saying this, but maybe I should continue my education and go on for my doctorate. I was really enjoying what I was doing. And said, I want to learn more. I want to be able to be more helpful. And so I was married at the time, and every year I would think, should I do it? I shouldn't do it. I couldn't quite pull the trigger. And finally, I was in around my mid-30s, and my wife said to me, Josh, you're not getting any younger. If you're going to do this doctoral degree, this is the time. So we made the decision, and we went for the doctoral program. And for me, it was the best decision I ever made. I led to my doctorate, and I led to an advanced certification in school neuropsychology. And it led to a private practice and some writing, and I just best decision I ever made.
Awesome. So as a neuropsychologist then, right, what do you do for neuropsych evaluation? Just jumping into this idea of why would I get a neuropsych evaluation for my child? What are the benefits?
Yeah, it's very comprehensive. A neuropsych eval is really considered the gold star evaluation, depending on if you're worried about certain presenting issues. For example, a neuropsych eval, there's a cognitive piece, an IQ piece, a cognitive piece. There's an academic piece, achievement, reading, math, writing, looking at any type of a learning disability. There's a neuropsych piece for language and memory and learning. There's rating scales, there's projectives. And it can really lead to what's called a good differential diagnosis, get that diagnosis as accurate as possible. So for many patients I work with, they've been receiving interventions for years, and the interventions haven't been as helpful as maybe they should or could be. And sometimes it's because that diagnosis isn't as accurate as it should be. For example, sometimes it's ADHD, but maybe it's more executive functioning, or maybe it's a processing issue, or maybe it's a learning disability, or maybe it's a little anxiety. And getting that diagnosis as accurate as possible is the first step. And then the neuropsych eval can also lead to a good profile of the student or the patient. So the cognitive and neuropsych strengths and weaknesses, and we can put a plan into place to help them moving forward. So if you're looking for something with a lot of empirical support that really digs very deep, then the neuropsych eval might be what you're looking for.
So then often I think people start with a psychological evaluation, right? And they might get a diagnosis for ADHD. So correct me if I'm wrong, I might choose to go for a neuropsych evaluation if it's maybe a more complex case and it seems like there's more than just ADHD going on and I want to figure that out. Or if it hasn't, like what we've been doing so far hasn't been working and we need to kind of dig another level deeper. Is that accurate?
Exactly. So for example, a psychologist evaluation many times can be perfectly fine. Maybe that's all that the patient needs. You can do a structured, in-depth interview with a psychologist. They might do some rating scales. Some individuals I know will go to their pediatrician for an ADHD diagnosis or a psychologist for their ADHD diagnosis. It's a little bit quicker, but for some patients, that's all that they need. For others, if they're really looking to tease out exactly what the issue is, they tried certain things in the past that hasn't been working. Is it ADHD? Is it executive dysfunction? Is it processing? Is it memory? Is it anxiety? Are there comorbid issues, Veronica? Sometimes for many of these patients, there are many issues that go hand in hand. So it's not just ADHD, but it's ADHD plus anxiety or depression or a learning disability, whatever it is. There are many comorbid issues that can go hand in hand with ADHD, for example, or a learning disability, or whatever the issue is. So if you're really trying to tease out exactly what's going on and get a really good differential diagnosis and have something really in depth, then you might want a neuropsych, as opposed to if you're pretty sure and it's a pretty straightforward case, then a psych eval might be warranted.
Okay. As a school psychologist, you must have sat on special education meetings, right?
Lots of them.
So then what is the evaluation that you would get through a school special ed evaluation, and how is that different from a neuropsych evaluation?
Yeah. So a school evaluation, normally they're doing what's called a psychoeducational evaluation. And the primary purpose for a school psych eval or an evaluation through the school is just to determine qualification for special education. For example, through IDEA, Individuals with Disabilities Education Act, there are 13 ways to qualify for special education. It could be a learning disability. It could be other health impairments such as ADHD. It could be autism. It could be orthopedic impairment, etc. So they're trying to determine, do you qualify for services? And they're not really telling you they're not really diagnosing. They're not really getting in depth and telling you what the cognitive strengths and weaknesses are. And there's not a lot of empirically supported interventions. They're not thinking that deep. There are empirically supported interventions, but they're not thinking as deep. They're really looking to determine, do you qualify for special education, yes or no, through the school system? Where a neuropsych eval will diagnose more often, it'll dig deeper, there'll be more empirical support, the interventions will be more tailored to the individual. And for some patients, all they need is a psychoed. And of course, the benefit is when you go through the school system, they'll do it for free normally, always. They'll do a free evaluation, but they're just going to say, do you need special ed accommodations? Where in neuropsych, it's going to dig a lot deeper and really figure out what that exact differential diagnosis is and give you those empirically supported, tailored accommodations and recommendations.
Okay. So then the outcome, as far as like, what could you expect? What possibilities might open up after you've had a neuropsych evaluation? Like, how does it change? What happens after that?
Right. So at the end of most neuropsych reports, and mine in particular, there's a diagnostic part of the report, and then there's an interventions and recommendations part of the report. So based on the diagnoses, whether it's ADHD or a learning disability, et cetera, and based on the child's cognitive and neuropsychological profile, their strengths and weaknesses, we come up with all sorts of empirically supported recommendations to help moving forward, whether it's certain types of therapy or tutoring or psychopharm recommendations or whatever it is. There's all sorts of recommendations that are empirically supported to help the child moving forward. And they're really tailored to the child's strengths and weaknesses. So we're trying to build on the child's strengths and remediate the areas of weakness. And again, I know I've said this a few times, but those results are really tailored specifically for the child's cognitive and neuropsych profile. So they can really there's a lot of empirical support for the interventions. And then again, if you're really looking for something in depth, a neuropsych eval is what you're looking for.
Awesome. Can you also help one more area, tease out what would I expect as a parent to be different from the neuropsych evaluation, or is there any overlap with, say, speech and language or OT or PT? Or vision, right? Because I think that a neuropsych has a level of testing or assessing those different areas as well, or you consider that as part of your evaluation.
We do. So absolutely. So most neuropsychologists, including myself, will tailor the evaluation specifically to the referral question. So whatever the referral question is, I tailor my evaluation specifically to the needs of the child. Many times speech, OT, PT, vision are part of the evaluation as well. So there is some overlap, but the neuropsych eval is going to look at those areas as well as other areas as well. It's going to be a comprehensive picture of what's going on with the child. Many times in my evaluation, if I'm worried about an OT issue, such as a motor control issue, fine or gross motor, for example, or a language-based issue that a speech and language pathologist can help with, or a vision issue, or whatever it is, I may make a referral to work with those individual practitioners as well, because they'll do more of an in-depth, specific evaluation for those areas. Even though there is overlap, part of the testing, for example, in neuropsych might encompass speech and language, receptive and expressive language, for example, or communication skills. But if there's something I'm a little bit more worried about and I want another expert to take a look at, I'll refer the patient through the report and take my report, take it to the speech and language pathologist or to the OT or the PT and have them do their specific testing as well.
Excellent. So it's a wonderful way to figure out a whole picture of what's going on with your kiddo, right?
Get a whole comprehensive picture. Yeah, it's really, again, it's really the gold standard because it's so comprehensive. You have an overall picture of what's going on.
Awesome. So you've been doing your work in neuropsych and doing these evaluations and as a school psychologist for a number of years. And then at some point in time now you've decided to, and this I'm excited to get into talking about, because so many people need help with homework and having their child do homework. Right. And especially when a child has ADHD, it can be a challenge. So you decided to start to write this book about homework and for kids with ADHD. So can you tell us why, like what led to the writing of this book?
Right, it's homework, but it's also study skills for students with ADHD. So what I came across through my work is there's a lot of students with ADHD who struggle with study skills. There's a lot of books out there for students with ADHD. There's a lot of books out there for study skills, but there's really nothing out there that looks at and works with children with ADHD specifically to help them with their unique needs. So for example, my book, the Homework Squad's ADHD Guide to School Success, it looks at specific reading, writing, math, but there's also listening skills and concentration and memorization and goal setting and procrastination and all sorts of things that the ADHD student will struggle with. And there are specific study skills and homework skills in the book that will help the ADHD students specifically reach their potential. It really kills me to see students who aren't reaching their potential and children who think, well, I'm just not smart, I'm not bright. I struggled with some of these issues as a child myself. I probably had an undiagnosed ADHD inattentive subtype diagnosis myself when I was younger, but because I was getting by okay with my grades and because I wasn't a behavioral issue, I didn't raise any red flags and I kind of flew under the radar. But for years, I kind of felt, well, maybe I'm not smart enough, or maybe I'm not adequate enough, or my self-esteem took a hit. And it kills me to see a lot of students who are bright kids who just need empirically supported specific recommendations to help them. And through my work, a lot of these students with ADHD specifically feel that, well, I'm not smart, or I'm not good enough, or I can't succeed academically. And with specific interventions to help the ADHD student and I put a lot of them in my book, I feel like that can help students, especially at an early age.
So then how would one use this book? Is it written for parents to help with designing study skills, or is it written to the kids? How do you foresee utilizing the book?
It's for both. So the book is written in kid-friendly language. So there's a team of 4 students that band together called the Homework Squad, and they come together to write the book. This book is written for children that can read themselves from ages around 8 to 12. But it's also written for parents to help the students with the book. Parents can read it, teachers can read it, administrators can read the book, and they can help the students implement the skills themselves. So some students I know will read the book on their own, but for many students, the last thing they want to do is read a book, especially if they struggle with reading or with study skills. So the parents can read the book with the student, the teachers can read the book and implement the techniques and the what we call tricks in the book to help the student kind of reach their potential.
You hit on exactly one of the things that I love about your idea for writing this book is that having the squad come together in the story, it makes it more fun and engaging and exciting. And even as a parent, like I enjoy those things so much too. Like it adds levity and fun to it and engagement for me to read and learn it, right? Or to utilize with my kiddo. That's one of my favorite ways to do things is.
Oh, thank you. Yeah, we try and put a lot of humor in the book, and we try to write it from a kid perspective, right? So when an 8 to 12-year-old or 7 to 13, 14 in that age range is reading the book, they can feel like the Hunter and Mateo and Michael and Prisha, the characters in the book, are speaking directly to the child. And they use, for example, they'll use a lot of jokes in the book, a lot of levity in the book, but they try and get their point across. And again, if the student is incapable or unwilling to read the book, the parent or the teacher can step in and read it with them or read it on their own and help implement these skills.
Can you give us an example of what a study skill strategy looks like?
Sure.
Find inside there, yeah.
Sure. So, for example, a lot of students with so the skills are written specifically for students with ADHD. You know, learning disability students might find the book helpful as well, but it's really written for ADHD. So, for example, a lot of students with ADHD will say, Dr. Shifrin, my eyes bounce all over the page when I read. Whenever I read a book, my eyes are all over the place. So a simple trick we use in the book is just taking a ruler or a pen or a pencil and putting it right under the line they're reading. Read that one line, and when they're done reading the sentence or the line, they move the ruler down and underline the next sentence. It helps keep the eyes focused from bouncing all over the page. We talk to students about breaking up into chunks. A lot of students get very overwhelmed by long reading assignments. So breaking it into segments. So reading a little bit at a time, taking a short break, give yourself a little reward, and then moving on to the next segment, and break it down into chunks. There's all sorts of recommendations. You know, keeping your eyes focused on the teacher's eyes when the teacher's talking if you lose concentration a lot. And making that eye contact whenever possible, the teacher can help keep you engaged. There's a lot of recommendations in the book and tricks for students specifically with focus and hyperactivity to help them really get the most out of their potential.
Yeah, I love that idea. Thank you so much for putting those two ideas together. Another side benefit that I could see from what you've done here then is that kids will feel not so unusual, right? Like it's not just me. And that of course always helps self-esteem and feel better and be like, okay, I can,
so
other people have learned to do it, I can too.
It's so funny you should say that, because right at the beginning of the book starts off with Hunter, the kind of the main character, who's struggling in school and struggling to learn. And he tries to he puts up a sign in school saying, if you struggle in school and you have ADHD, meet after school for this meeting. And he's so worried that nobody's going to come or people are going to come and laugh at him. And then other people show up with the same issues. And it's so validating to feel that other kids do have these issues. And in reality, Veronica, as I'm sure you know, the literature differs a little bit. But anyway, 6 to 10% of students, maybe more, have ADHD. It's a very common issue. And mental health issues are very common. But because so many individuals feel they're the only ones that have it, there's a stigma, they don't want to talk about it. So in this book, the group bands together to help themselves, and they put together this guidebook to help other students that are similar to them as well.
That's awesome. That's wonderful. Now I want to read it. So people can actually, well, it's not available as of the recording.
Not available yet,
so,
yeah.
So I haven't gotten to read it yet. Where can we find it?
Sure. The best place, of course, the Mecca, Amazon, right? Amazon has everything. So it's available for pre-order right now on Amazon. The Homework Squad's ADHD Guide to School Success. So if you put in Joshua Shifrin, I've written several books. The books will pop up. It's available on August 3rd. It'll come out. So from this recording, about a month from now, but by the time the recording goes out, August 3rd, it'll be available. It's available for pre-order. Or the APA, American Psychological Association, that's the publisher, the children's imprint, Imagination Press. So if you go to imaginationpress.com, you can find it there as well. And eventually, if you can pre-order it, that would be terrific. But if you want to wait, it'll be available anywhere books are sold once it comes out.
Awesome. I'm excited. Looking forward to it.
Thank you, Veronica.
As we're looking to wrap up this conversation, what other tips or suggestions or would you like to share with parents or teachers?
Yeah, I think the main thing is early intervention is the key, right? So if you have a child who's struggling, whether it be with ADHD or a learning disability or a processing issue or anxiety or depression, whatever going on, the earlier you intervene, all the literature says the same thing. Early intervention leads to the best treatment outcome. So it's funny, I originally envisioned this book for ADHD and study skills to be for a college-age population. And I pitched it to a bunch of agents, and the agent I'm working with now, Connor Reck from Lucinda Literary, said, you know what, I love the idea for the book, but let's get them while they're young, right? Let's do this book for younger kids. And I said, you know what, why didn't I think of that? I mean, because early intervention is so important, get the kids on the right track right now when they're young. So if of course, an evaluation or interventions can be helpful if you're in high school or college or even as an adult. But if you have a youngster who you're worried about, the earlier you intervene, the better off the outcome most likely is going to be. So if you have a child in elementary school or middle school who's struggling, don't wait till high school, don't wait till college, get them assessed earlier. And that's one of the reasons why my book is written for the population it's written for, these younger age kids, to get them started on the right track when they're young and to get them off on the right foot.
Wonderful. Thank you. I'm looking forward to when it comes out. And in the meantime, if someone wanted to find you for your practice.
This is actually neuropsycheval.com, neuropsycheval.com. That's my personal website for Neuropsych Eval. And my books are on shifrinbooks.com.
Perfect. We'll link both of those.
Awesome. Thank you.
Below. So what a pleasure to speak with you today. Thank you so much for taking the time to share with us about neuropsych evaluations and homework or study skills and homework help. And I am very much excited to getting that book because I will be using it.
I really appreciate it, Franco. Thanks for having me on.
Wonderful. Thanks. And we'll talk to you later.
Take care. Thank you. Bye.